Only a few structures you need to remember. The cricothyroid membrane is your point of interest. This is the membrane you will puncture and pass your endotracheal tube through. It's tightly situated between the thyroid cartilage superiorly and the cricoid cartilage inferiorly. Now pay careful attention how these key structures lie in the midline of your patient. That is the direction you will be cutting in, especially in an emergent situation. That's because there are some important structures that are found immediately lateral to the larynx. And to palpate the thyroid cartilage, you could also feel for the laryngeal notch to orient yourself to midline. You'll want to next palpate the cricoid cartilage so that you can define the inferior edge of your target incision site. Because remember that the cricothyroid membrane lies between the cricoid and thyroid cartilage. Once you've oriented yourself, you could start feeling midline for the cricothyroid membrane, which will be the target puncture site. When you're ready to cut, hold the lateral edges of the larynx so that when you cut through the skin and soft tissues, the larynx stays midline and does not shift underneath the soft tissues when you make your first incision. After each incision, palpate feeling for the cricothyroid membrane. You may need to cut a little deeper each time, but keep in mind this is not a delicate, gentle incision. Your incisions should be deep enough so that you can palpate the cricothyroid membrane after 1 to 2 incisions. Once you're through the soft tissue, rotate the scalpel 90 degrees and use the scalpel to puncture through the cricothyroid membrane. You're going to make small horizontal incisions across the membrane, enough to fit your finger between the thyroid and cricoid cartilage and into the airway. This is where it could get messy. Blood may begin to pool into your visual field, and you will likely lose sight of your incision. Don't panic. Remember, this is going to be primarily a procedure by palpation, so there's no need to blot the field with gauze or suction. In fact, you could use the blood as lubricant to slide your fingers over the landmarks to reorient yourself, and then sliding your index finger past the flanking cartilages. With your finger in place, exchange it with your bougie, aiming it downward into the trachea. Once you've made this exchange, you can now feed the endotracheal tube over the bougie and into the airway. For more information and learning material on cricothyroidotomies and other medical things, visit our profile on